This is the Senior Dog Summit pre-launch kickoff party. I have collected here a set of distinguished veterinarians, therapists, educators, speakers, and we're going to have some fun tonight. So I'm going to introduce each one of our guest speakers, and then we'll get on to the program. I'm going to start with Will Falconer. We were actually classmates in vet school, so we spent 4 years huddled together in classes and going out together. So I really appreciate him being part of this. And he started out in conventional veterinary practice in 1980, using all the latest drugs and surgeries. After 7 years, he followed an inspiration that led to holistic retraining and finally to his full-time homeopathic practice, treating animals globally without drugs. His goal is wildly healthy animals with natural disease resistance and confident owners who call the shots for their animals. Dr. Falconer uses nature to inspire and guide his work and educational efforts. Next is Dr. Amy Hayek. Now, Amy, I've known via the chiropractic world. We're both members of the American Veterinary Chiropractic Association. And that is one of Amy's certifications and her postdoctoral training. She also has postdoctoral training in acupuncture, advanced neurology, and nutrition as it relates to environmental effects on animals. Amy trains animal chiropractors and animal owners to understand that animals, like us, are always in tune with the environment. And she likes to help point out that many animal owners don't realize their animals are self-healing, but they and we are. Next is Laurie Edge-Hughes. Laurie is a physical therapist from Canada. She has a master's degree in animal physiotherapy and certifications in canine rehabilitation and acupuncture. She taught the first courses in canine physical therapy, I get this, in Canada, the USA, and Australia, and is sought after as an instructor on this subject worldwide. She owns and practices out of the Canine Fitness Center in Calgary, Canada. So I welcome all of you here with us tonight. So the Senior Pet Summit, we're focusing on those older to aging geriatric dogs and keeping up with them throughout those transition of years really requires some diligence on the part of the owner, because there's so many turns and kinks and places where things could go wrong, and also that accumulation of whatever they've got on them from all of their years. So with that in mind, each of you have been selected to be a part of this program, and I'll take each of you one at a time. And I want you to give us a little bit of information about the topic that you're going to be sharing with us during the summit. So Dr. Will, we'll start with you.
All right. Well, I've been asked to talk about inflammation. And first and foremost, I want everyone to know that inflammation is natural. You know, we tend to think of it as the bad guy, and you see these shopping aisles down the grocery store that are full of anti-inflammatory drugs, but we'd be lost without inflammation. Inflammation is part of nature's book of tricks to help us heal when we need to heal from acute injury or acute disease like parvo. Inflammation comes in and knits things back together. So that's a really important thing to realize. And whether you're injured or your dog is injured, you want inflammation to help you heal it. We recognize it by its fourfold symptom pattern. There's heat, there's pain, there's redness, and there's swelling. Some combination of those things will tell us, inflammation is going on. Those aches after a flu, that's inflammation. The red swollen ear that your dog's got from an allergy, that's inflammation. And we all do this in acute situations to heal. But what we're not wanting, and what we see all too often, is called chronic inflammation. And don't let that word scare you. It just means it's stretched out over time, right? Instead of acute, which is fixed and short, and you expect it to be done in days or at most a week, chronic means it can go on for weeks or months. That's what we are not wanting. And that's what gets often tagged with the itis word, right? So arthritis is chronic sore joints, and dermatitis is this itchy, inflamed skin, and otitis are these horrible ears that hurt and stink often, and they're painful, they're swollen. Enteritis, hepatitis, and encephalitis, et cetera. So we can get it in any part of our bodies, as can our dogs. So when you hear that itis word coming up from your vet, that's what they're talking about. You've got some inflammation going on in your dog. Well, the thing I want to take everybody through is that chronic inflammation is man-made. It doesn't happen in the wild ancestors. That's how we know it's man-made. So it turns out that the wolf is your dog's closest relative. 99% genetic overlap in the mitochondrial DNA between these two species. And do we ever see a limping wolf in the wild? Briefly, maybe, but not aged and limping because of chronic inflammation. That's not reality for the wolf. Do we ever see chronically inflamed skin where these wolves are just itching and, beating their coat out with their hind paws and, miserable all the time? No, they could have an acute dermatitis, but they'll get over it and not be expected to go on for weeks or months. Similar with ears, you'll never see a wolf with a chronic head tilt who's digging in that ear and it hurts because it's so inflamed, he's allergic to something. That's all man-made stuff. So the norm in nature is to suffer some of these things acutely, short term, but not to go on and on. So how do we create this chronic inflammation? How does man create this chronic inflammation? The three main things I come back to over and over again are first, vaccines, which can create allergies. We've followed that for years now. Often a month after a round of vaccines, somebody starts itching their feet or scratching their ears. Very, very common. It's not on the immediate heels of a vaccine, but look out a little bit down the road, you'll see it. And autoimmune disease is another sequela or aftermath of vaccination, and that's the more deadly one. That can come on within 48 hours of getting a vaccine. Luckily, we don't see it too often, but that's where the body attacks self. Now it takes out red blood cells, which you need to live, or platelets, which you, of course, need to clot your blood. So that's the big, probably number one cause is we over-vaccinate. Some of our colleagues vaccinate, 40% of them were claimed to have vaccinated yearly in their practice, which is a baseless practice, no science behind it at all. The second is poor quality food. So let's contrast the wolf and the dog. The wolf is eating what? One thing, it's prey. And they're on the go for it, which we'll come to a little bit later, but they're eating fresh, raw, warm prey. Hasn't gone through a campfire first, hasn't been made into a little food-like particle by science, right? It's prey. Very, very different from kibble. And the third thing we do to our animals is we probably unknowingly poison them with pesticides, whether it's for fleas or ticks or heartworm. Those classes of medicines are all pesticides. So the longer these things are in use, the more likely you are to create a chronically inflamed state. A glaring example is allergic skin disease. All those symptoms come about from a wild overresponse to normal things. Dogs live in the world. They could take a bite of chicken as a normal course, as would a wolf eat a bird off its nest if he could get it. But the allergic dog is wildly overreacting to that and now breaking out in skin disease or ear disease, otitis. I call this immune confusion. A grass or a pollen could do the same thing. You have a shopping list oftentimes of how many things your dog is allergic to. That's all man-made. Cranial cruciate ligament injuries is another one. We tend to think, oh, that just happened because Bowser stepped in a hole. No, the scientists have shown us that there's inflammation against that ligament for time before the injury ever took place. So we've created this and we can undo it or we can avoid it. So how to avoid it? will want to minimize or intelligently avoid altogether vaccines. And by that, I don't mean just do nothing against infectious disease, but intelligently avoid it like my students do. And we can choose a raw balanced diet. These are available in many forms now. They're frozen, they're out there on the market. You can find recipes to make it balanced yourself. And we'll get much closer to prey with that than we ever would with a kibble, which is so highly processed and heat denatured that it's nothing like real food for a dog. And we can find alternatives to keep the fleas away. The best, by the way, the number one best way to do that is to have a super healthy dog. I've seen this over and over again. They actually repel the fleas and the ticks. The fleas jump on, they go, oh, no, this isn't a host I want to stay with. Let's get out of here and go find somebody who's weakened. So that happens regularly. And we want to start from puppyhood because, as Ava said, it's an accumulation of things, right, over time. But even if you haven't started from puppyhood, start now to shape these things in your dog so that you're building better and better health as you go. So that's it.
Will. We appreciate that as a snippet and intro to what's going to be ahead. And next we have Dr. Amy. Your topic was chiropractic. So share with us what some of the pet parents then will be able to see in the presentation that you'll be doing on chiropractic.
Thank you, Ava. I have to say, I'm really glad you chose me for chiropractic because that's really near and dear to my heart. And it definitely is one of those things that I think a lot of pet parents don't know enough about. I think that chiropractic in general is starting to gather more hold in veterinary clinics. We're starting to see more veterinarians who want to take the course and learn what chiropractic can actually do for their patients. But one of the things that we see just in broadly in the public, in the media, in the popular media, is that we don't hear anything about how chiropractic can actually help people or their animals. We hear so much more from the allopathic medicine or the drug companies about what they can do for X, Y, and Z illnesses. So in my talk, we're going to talk a little bit about how chiropractic works. We're going to talk a little bit more about the idea of chiropractic because I think it's kind of an ethereal thing for people. People come in and they say, I want my dog cracked, because they hear the noise. I mean, when people get adjusted, they oftentimes make lots of loud noises in the chiropractor's office. A big part of that comes from the fact that people in general are more dehydrated than our animal patients are. And because of that dehydration, there's less motion through the joints. There's more gas buildup. And so it makes more noise. But in our animal patients, we don't hear those big noises very often. And when we do, it's quite surprising to everybody for the most part, including me. And so we're going to talk a little bit about what chiropractic really is and how we can think of chiropractic as the continual maintenance of the animal, right? So even though we're talking about older patients, even though we're talking about patients who may not have ever had the experience or the opportunity to have a chiropractic adjustment, we'll talk about what constant maintenance will do to help them. And we'll talk also about how, for instance, the chiropractic adjustment moves and helps that body communicate better with the environment. So in chiropractic, there is a term, and I don't know that I identify it in my talk, but it's called the innate. And different modalities use different terms to talk about the same kind of thing. The innate, the chi, the chakras, things like that. And the way I define it is that the innate is the body's communication with its environment. Every time a cell gets a signal from outside, that cell gets nutrition which gives it a signal to code for a protein. What does that mean? That's like you getting a call and saying, hey, please send me, whatever product you happen to sell. And so you go and make the product and then you ship it out. Well, the cell does the same thing. It takes the products that it's given and it makes a protein and it ships it out. But every time it does that, so cells are nicer than some people in that they send out also a signal with each protein that says, hey, this is coming. And that's part of that signal that goes out, not just to other cells in the body, but also to the environment itself. That's how we exchange information between bodies. Many of you are probably familiar with the idea that when there are a lot of women working in one office, they all will cycle up together. And that's because they are exchanging that information, those chemical signals. You're also probably familiar with how dogs can be taught to do a lot of things like detect a diabetic crisis or a seizure crisis. And those two are chemical signals that our animals are really attuned to. So one of the things that chiropractic does is it helps these cells to talk better to each other. And when they get a chiropractic adjustment, all of those cells get rid of their waste products. So in our senior patients in particular, we have to be very careful and concerned about who we choose as our chiropractor, because we want to choose a chiropractor who is well trained. We don't want to choose an animal chiropractor who is not a doctor, because they don't have the background, they don't understand the pathology, and they don't understand any of the physiology that goes on in that animal to a degree that will help them make a good assessment of your senior patient. And when that senior patient gets an adjustment, quite often we've got all these cells that have been doing all this work all their lives, and like Dr. Falconer talked about, have built up some inflammation. They've built up inflammatory chemicals that they haven't been able to get rid of. With the chiropractic adjustment, we release a lot of that excess built up inflammation. But if we release it all at the same time, it becomes very toxic to the animal. It can actually make your older animal more ill for a short period of time rather than less. And that's one of the reasons it's so important to find an animal chiropractor who is trained and certified. So we really encourage all of our graduates from our school to take the AVC exam, the American Veterinary Chiropractic Association exam. It is like a board exam, and it helps people to know that that doctor is certified and knows enough to be able to adjust your senior patients in an appropriate manner without, the term we like to say is flushing all the toilets in the house at once. We like to just flush one and then let the septic system recover before we flush the next one. So we're going to talk about that in a way that helps people visualize and understand what chiropractic really is. Because I think for the most population, not many of us have ever seen a brain or a spinal cord, or can even envision what it does. And if you've ever seen one, they don't look like they're doing anything. And so in order to talk about the activities that go on in there, I've used a few analogies in my talk so that our animal owners can get a feel for what it means to get an adjustment. And they'll be able to make a decision about their animals. One of the biggest things that most people have a hard time deciding is, does my animal need a chiropractic adjustment? How do I decide? So in my talk, I will actually talk about one of the exams that we use and something that pet owners can actually do at home. And that is the leg length exam. Is non-invasive. It's something you'll be able to see with your own eyes, and it'll help animal owners be able to determine if their pet is due for a chiropractic adjustment. So during the talk, you'll be able to see images and examples of how to do that leg length exam. So you'll be able to go home and examine your own dog and decide if this is appropriate for them.
Very good. Thank you, Amy.
Thank you.
All right. And next up, we have Laurie coming in from Canada. And you are such a great presenter. I follow your blogs that you have all the time, and I've got some from years and years ago in my email because they come back around and they can be so appropriate at a certain time to share with somebody. So tell us a little bit about what your program is going to be for our Senior Pet Summit.
Sure. Okay, so my talk is on novel ways to exercise your senior dog. And my two main giveaways, because everybody knows, well, you can walk your dog, you can do balance, but nobody really thinks about things like power training or high intensity interval training. And these are very novel thought processes, and especially for our dogs and especially for seniors. So power training is strength plus speed, and high intensity interval training is basically short bouts of high intensity exercise followed by a much lower level, so a rest, still moving, but a resting stage. And the reason why these are so important for seniors is because this is what we need all the time, we people and the senior dogs. Because if you think power is, if I think of humans, right? A power is, walking up the stairs with your groceries, or reaction time when you're driving a vehicle is a speed, or being able to catch yourself when you start to trip and fall. And while our dogs aren't driving or bringing groceries up, but it's all very much the same. Coming up the stairs is a power activity, or even if it's like squirrel and they go to chase something, I mean, they need to have the mechanisms at hand to do this. One of the things that happens when animals age, people being animals too, is we start to lose our type 2 muscle fibers. And your type 2 muscle fibers are very involved in strength and speed. So these two, power training and high intensity interval training, really target strength and speed. So it will help in that capacity. So I'm going to talk a little bit about how we can do that safely, some fun and easy ways that you can incorporate power or high intensity intervals into your exercise regimen. I'm going to provide a few caveats of when this doesn't apply. So there are a few things, there are some conditions where you really have to think, maybe not. And I always say the caveat is, if you've got big concerns, you're checking with your vet. And then the other thing to note is how much exercise is too much exercise. And so my one little giveaway with that is your animal should never be more sore that evening or the next day, at the end of the next day. A little bit of stiffness is okay, but if that perpetuates, then you've likely done too much. So that's kind of a little bit of a wrap up gist of what I'm going to be speaking about.
Very good. Thank you all for sharing those introductory informations about each of your programs. All right, so the next part is that we're going to talk about weight and obesity. And so the question is going to be, what are your top 3 things that dog owners or pet parents should consider when trying to get weight off of their senior dog? So what are your top 3 things to consider about weight? And I think this time I will start with Dr. Amy.
Well, thank you for asking. I think sometimes one of the biggest things that I see in dogs that perpetuates weight is kind of this vicious cycle. So there's a start with my animal's not moving very well. And then one of the bigger things that causes some of their weight related issues are long toenails. So keeping those toenails trimmed so that they are not on the floor is very helpful in helping those dogs move better so that they can then keep the weight off, so that they can be more active, and so that their metabolism stays at a better rate. That's not to take away from the fact that I think we will all probably agree that a proper, a natural diet is going to be one of the important things that helps those animals' metabolisms stay in a more normal range. So that's where I would start, is motion, toenails, and diet.
Motion, toenails, and what was the last one?
And diet.
And diet. Okay, very good. All righty. Next, Laurie, I'm going to ask you, what would be your top 3 things that you would share with a pet parent regarding weight or obesity?
Fabulous. Okay, so I'm going to tag on to the movement component. So definitely sometimes it's just a matter of get them moving a little bit more, a little bit doing something a little bit extra. So just to increase the movement. Number 2 is, we'll call it the treat jar, in which case I had a client bring this up and they said to figure out how much they were actually, it was her parents, were actually giving the dog as treats, is she said, every time you give a treat, give one to the dog, put one in a jar. So that at the end of the day, she actually knew how many treats her parents were giving the dog, and it was far more than anybody expected. So then that helps then to factor in is to actually count the calories, to figure out how much this dog is actually eating. So you'll likely need someone to help you. There are some good websites, but likely your veterinarian, or there's, like I said, there's websites that can help you actually look at, this is how many calories are in a milk bone or a miniature carrot, and actually look at how much the dog is eating, because I think that's where you go, it's more than you're thinking. So that's my 3. Oh, 4,
Okay.
3.
Very good. All right. Next, Dr. Will, what would be your top 3 points that you would want to share with the pet parents regarding weight and obesity?
My number 1 is diet related, and it's carb avoidance. I've been studying insulin resistance, which is, if you haven't looked that word up, do. It's a very interesting subject, and we're probably all suffering from it. But back to the wolf, wolves don't eat grains or starches, which, by the way, all your grain-free, quote unquote, kibbles have starch to hold them together. It's by definition, they're starchy. And simple carbs push dogs and people into this thing called insulin resistance. And that's a sure formula to push fat into more deposition and to grow fat cells. Second is regular fasting, which every wolf would do on a regular basis. So we can mimic this, right? Prey isn't at their beck and call. We can mimic this with a day a week of fasting, regardless of age or breed or weight. A dog can miss his meals on, say, Thursday of every week, and just have broth, nice warm broth, whether it's bone broth or veggie broth or meat broth, just nothing solid for that day. Do other things to love them and play with them and get them out and all that sort of thing, but no food, no solid food. And the third is exercise, as we've already touched on. But what does a wolf do all day long? They're on the move, right? They're not sedentary. They have to hunt in order to eat. So we can mimic that in any number of ways. I'd like the sound of high intensity interval training. That sounds pretty cool. And just get these animals moving on a regular basis. Again, mimicking what we know the wild ancestors and cousins do, you'll always be in good shape.
Thank you, Will. That's really good. I was envisioning my dog on the first time that she has to take her Thursday only liquid fast. She's gonna think something's wrong with me. Mom, you must be thick. All right, way cool. All righty. Thank you all for that. That was great. So the next part of our kickoff party tonight is that we wanted a case. So I thought, okay, what's something that we see in our seniors? So this dog is going to come to visit you. And the question is, how would you treat? So we've got a male Labrador mix who's a diabetic. He's also been neutered. And he's, that middle age to moving on up. And this dog is presented to you with stiffness and arthritis, but he's very happy and he's very friendly. So you've got this case, middle age to up, neutered male Labrador mixed dog that's also a diabetic, and he's got stiffness and arthritis, and that's why they've come to you. So I'm going to start with Laurie. See what you want to help this old fella do.
So there's
how would you approach him in that scenario, and then why would you do the things that you're going to recommend?
Okay, perfect. So there's two different trains of thought here, and I actually was taking all sorts of notes before I got notes on all the things, because when I look at this, there's the two components, and one is the diabetic component, and the other is the stiffness and the arthritis component. So if we go with diabetic first, we're going to want to make sure that they are in check with their veterinarian, and if they're going to start some sort of exercise and keep their dog moving, we just want to make sure that everything is in check, that however they're managing their diabetes is in check before starting some sort of an exercise, especially if they're inactive or if it's a new diagnosis. Exercise is good in that it can decrease blood glucose and boost insulin sensitivity, but we don't want to overdo it in these cases. So we want to start slow. And typically for a diabetic to exercise, we would add aerobics. And what we say in the human side is it should be every day, whether that's just walking, no less than every third day. So we want something regular. Balance exercises can be good, and that could just be, I call it around the world, lift a leg and balance, lift another leg and balance, lift another leg, not one at a time, not all four at once. Weight training is something else we do with people. So we can do this again, walking hills, walking stairs can be well. Again, if this is a new diagnosis and the dog is now newly exercising, it might be something that if the exercise and this is not yet a managed diabetic case, in people, low blood sugar can look like a person is wobbly or dizzy or confused or shaky or weak. So it might be something for the owner to know and have something in their pocket that they can feed the dog on the way. Now that's the diabetic component, but the stiffness and the arthritis component, as the physical therapist, I'm like, ooh, lots there. So you don't say where they're stiff. So full body evaluation, see how all the joints move, flexibility, feeling what is sore, which muscles are sore in combination with which joints are stiff. And then there are so many things from a physiotherapy perspective for pain, and whether that is the modalities like laser or shock wave, whether it would be something like acupuncture or all of the above that can help with that. Water therapy is great, exercising with swimming, underwater treadmill, any of that. And if they're stiff and sore, short bouts of exercise multiple times might be better than a big, long 40-minute walk. And lastly, for me, home program is key. So there's likely lots that I can show that owner to do, whether it's some home manual therapies like massage, range of motion, stretching, just different things like that they can do to manage that dog as well. So there we go. My brain is just ping, 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 ping.
That's awesome. And I think that's our group, our audience for this program too, are people who want to have something to take home and do at home. Yeah. They're not just, okay, you give me this and then that's all there is to it. They want to be included in this process of, yeah. So you're able to offer that to them.
Yeah.
Thank you, Laurie.
Good.
Thanks.
All right, next up, Dr. Amy, what are you going to do with this middle-aged, neutered Labrador mixed dog that's diabetic, stiff, and arthritic?
When these dogs come to our clinic, we do kind of the same. We have kind of a similar a protocol that we run through. One of the first things we do is look at the motion between their head and their legs. We look at a leg length exam because we're going to assess, is that spine moving like it should be? And if it's not, we want to help it move. One of the things that contributes to changes in metabolism is everything that's going on in between the head and the neck. So if we were to take this dog and we wouldn't do that, but dissect it out and look at, when we cut the head off, all the things that are sitting in that space include the thyroid, the pituitary, the thalamus, the hypothalamus, the brainstem. All of these are elements of the immune function of the dog, but they're also going to have a lot to do with metabolism, which are going to have an effect on pancreas. They're going to have an effect on GI tract. They're going to have, so that feedback loop, by feedback loop, the communication between the brain and the gut, which is what really sets them up for diabetes. So we're going to take a look at that part of the spine to see that it's moving appropriately. And if it's not, we're going to adjust it so that it is moving appropriately. And because it's an older dog, that may be all we do, because we want this dog to be able to rebalance itself a little bit before we do anything further. On the second visit, which might be in a couple of days, it might not be in a long time, but it'll be in a few days, we would take another look at the dog and see how the dog itself has processed all of that. We see these guys, I have to say, on a pretty regular basis. And I'll tell you, I've had this conversation with an older Labrador owner, and the dog literally, she would get the dog out of the car, put it in a wagon and wagon it into the clinic, and then ask us to work on the dog. And with my experience with these particular cases is that if the owner is unwilling to make a significant change in their diet, and it has more to do with, I think, being the Labrador than anything else, because different breeds respond differently to treatments. If this was a Chihuahua, it'd be a way different scenario. But in our Labrador patients, if they're not willing to make a change to a raw diet, we can adjust them all day long. They're not going to make a significant shift in their metabolism. When owners are feeding that dry, hard kibble every day, we think of it like taking them to McDonald's. And we all know the science behind the McDonald's hamburger that sits on the windowsill for 42 years and doesn't change. And we explain to them that kibble is basically that same hamburger. And it makes the dog, it increases that dog's inflammatory component, but it also shifts their metabolism. And so one of the biggest components is to get the owner to understand that changing that dog's metabolism comes at home in their diet. And we like to help them in the most simple way possible. And so we usually recommend a commercial raw diet, because all they have to do is order it, it shows up, and they can feed it according to the package. For some of those owners, that is the best way, because they liked the kibble because kibble is convenient. And so shifting them to a commercial raw is one of the most convenient ways. There are other owners, though, who are going to want more, hands-on. I want to make my own food. And so for those owners, we caution them that they have to make sure that they have a recipe that is balanced, that contains organ meats, that contains bone, that contains skeletal muscle and some vegetables, because those are the components that make up that balanced diet for a dog. So kind of comes back to diet, and then routine chiropractic care, because we want to be able to continue to help that part of the nervous system to have a good communication with the rest of the body. And the third component, which I think I said this earlier, that we always look at are toenails. And I've even had other veterinarians say to me, how can toenails change the metabolism of my dog? But the nervous system has two parts. It has the sympathetic part, which is the run and fright and flight or stress, and any animal that's in constant stress. So as an example, if you were under immediate duress, say something very frightening happened and you had to run out of your house, if we drew blood right at that moment, you would look like a diabetic. But in an hour or so after that stress, that would all quiet down. When those animals are in constant daily stress from long toenails, which make the animal not be able to use the muscles that help them stand up more efficiently, it makes them use the muscles that help them run to stand up. So when that happens, it shifts their nervous system from being a balanced nervous system to being more fight and flight all the time, which throws them into that diabetic situation. So quite often, trimming those toenails can do a huge favor to that dog and help them to decrease their sympathetic tone, make them less in the flight part of their system, and bring up the part of the nervous system that helps them to balance their metabolism. So those three things: diet, chiropractic, and toenails.
Very good. Thank you, Dr. Amy. Okay. All right, Dr. Will, it's up to you to share how you would approach this good old boy.
Well, you're talking to a classical homeopathic vet here. So what we're going to do is focus on the whole dog. And in classical homeopathy, it means often spending an hour with the owner, getting all the details about this guy. Yeah, we know he's diabetic. That's a diagnosis. We know he's sore. What does that soreness look like? What makes that soreness better or worse? Is it worse when he first gets up and it's better as he moves, et cetera? All those questions come up. But beyond that, we're going to look at things like, unrelated to all those things. What are his teeth like? What are his behaviors like? Is he afraid of the dark? Is he, thunderphobic? How's his stool? How's his urination habit? All that stuff, because we're looking for remedies that treat the whole dog. And the goal is, in classical homeopathy, we give remedies one at a time to prompt a healing response from within. So we're triggering his vital force, same as the innate, as mentioned earlier. We're triggering his vital force to say, hey, we've been fighting this disease for a long time, these diseases by name, and let's get the fight turned up and finished. Let's not stretch it out any longer. So is it bad breath? Is it waxy ears? What do you got in this dog besides, yes, he's lame and he's got diabetes? So when the whole dog is treated this way, we expect everything to get better. And it's a process. It's not do it yourself, one remedy fits all. It's a very individuated process. So it's hiring a professional to take you on and do that with you. And we would never do this without diet manipulation as well. A good homeopathic vet is always asking, what's he eating? And changing that around, as we've spoken of, had some great tips already from the others, is that get him on something that's not carb laden, get him on a good fresh raw diet that's balanced, and support that effort by him to get over his illnesses and throw them off. keep touch with the insulin levels, because as he gets healthier, he's going to need less and less, right? So we want to keep monitoring that and ratchet it down as he's getting better. And at home, that's on you, right? That's what you can do. You are the diet provider, and you can get further educated on that. And as mentioned, get, just a commercial raw food to start with if you don't want to get involved in making it, but get off the carb-laden kibble. Your big job also for the homeopathic vet to do his or her work well is keeping a log, a diary of symptoms. We've got a list of these symptoms. He's got bad breath. He's got lameness that's worse when he first gets going. And he's overweight. Put him across the scale every week and see how that's coming. How is the bad breath done? When we give a remedy, we're going to come back to you a few weeks later usually and say, let's go through your list. How have things done? Well, this got better. That got better. This new thing popped up. Well, it's not really new. I saw it, back when he was a 5-year-old, but I forgot to tell you about it. Oh, okay. Tell me more about that. So it's a process, and we'll use one remedy at a time, evaluated carefully before we decide on the next remedy for your individual dog. And the outcome is often very, very pleasant. Everything clears up when we're doing our job right. So that's what I would be doing. And in 5 minutes or less, classical homeopathy is a really powerful way to get those guys on the move.
Very good. Thank you all. Those were awesome contributions for helping this old guy. And I had picked that topic because that wasn't one that really came up in a lot of the presentations that we're going to be having. So I thought that made this evening be a little unique and brought out this diabetic patient and the different ways that it can be approached and helped aside from just the insulin. So this was awesome. I applaud you all. That was great. All righty. So let's see here. So our last part of our kickoff for the Senior Dog Summit is in thinking about the diligence of taking care of the senior. What is one tip? Each of you are going to give us one tip that you would like to share with the pet parents that are listening to us, listening with us tonight. So what is one tip? Dr. Will, what would be one thing you would like to share with the seniors?
The prevention has to be done in a non-conventional way. So what we're seeing is chronic illness as a result of conventional prevention overdone, right? Yeah. Too many vaccines, junk food coming off the vet's shelf, and toxins for everything. Kill the ticks, kill the fleas, kill the heartworm. So start early, but you can do a whale of a lot of good even starting later in life, just getting off of that wrong stuff.
Very good. All right. Laurie, what would be your one point?
I'm going to say, keep your old dog active. So exercise smart. So a little bit can go a long way if you're choosing smart exercises to keep them moving.
Very good. Thank you. And Dr. Amy, what is your final tip or takeaway point?
My final tip is going to be, don't be afraid to get started with them, even though they're older. They can't get better if you wait. So it's never too late, really, if they're still able to move, if they're still able to do some of those things that we've talked about. But better to start them sooner with a little bit than to not start them at all.
Very good. All right. So this has been a wonderful pre-senior summit kickoff. I think we've shared some awesome ideas, and the audience will have an opportunity to get themselves jazzed up to be ready for the summit that's coming ahead. So we appreciate the audience tonight. I appreciate all of you for giving your time up to be able to be a part of this panel and enjoy this little evening party. And we're just excited for this summit to get started, and we're inviting everyone. You invite your friends, your neighbors, Anybody with an animal, anybody thinking about getting animals, all the audience out there, just take this opportunity to learn from some fabulous speakers, educators, presenters from all walks of life in this arena of caring for these seniors. And that is the thing I think that you will find that permeates throughout every presentation, is that our hearts are there for these old ones, that we love taking care of these old guys and old gals and seeing them get better. I mean, it just makes your day when you can see them become younger and enjoy life and have a good time again. So in ending off, again, thank you all for being here and being a part of the Pet Summit. And we look forward to what it's got in store over the next few days.